the video, which was just played, and it enumerated all the advantages of becoming a CPHQ professional. But in case you want me to elaborate more on that towards the end of the training program, I'll be happy to elaborate. And I will talk about the different modules which you are required to study in CPHQ. Like if you want to become a CPHQ professional, then you have to appear for an exam, and what are the modules you are expected to study. I'll talk about those modules, and I will introduce you to those modules. After that, I will talk about some important tools and techniques which, as a quality professional, you should be aware of. In CPHQ, many people fail because of the statistical module. Means statistics and process improvement area asks around 66% of the questions. So around 60 to 70% of the questions are related to data analytics and process improvement. And many times, because in healthcare industry, these are not the subjects directly you are in touch with. So although you would be really knowing all the healthcare related procedures, but related to data or data analytics, it is a challenge sometimes. So in that case, we focus, and today we are going to focus more on that. Though those who are preparing for CPHQ, it will be a really, really beneficial session for them. Then, although due to the limitation of time, I might talk about leadership and even patient safety. Maybe one tool used in patient safety called FMEA, I may talk about. That totally depends on how much time is left towards the end. And then I will maybe very briefly, again, very briefly, I can talk about the projects, some of the improvement projects which we generally, we have done more than 2,300. I have lost the count, but more than 2,000, 3,000 projects, improvement projects we have done in the hospitals, including hospitals in right from East Asia to Middle East and to Europe. So right from National Healthcare Service hospitals in UK, and lots of hospitals in Middle East and Saudi Arabia and UAE and Qatar, and also Oman. In fact, I'll be traveling to Oman day after tomorrow for one of the clients in one of the hospitals, Sultan Qaboos University Hospital. That is also our client there. This time I'm not going there, but to some other hospital. So many hospitals almost around the world. John Hopkins, and Cleveland Clinic, some of the names, Sakura Hospital, which is Japanese hospital. These are all our clients, and we have done a lot of projects. So some of the projects, maybe if possible, I can't guarantee that still time will be remaining. And my team can tell me what is the time schedule for today. If you can just write to me, my team, it will be really, really good so that I can plan my event accordingly. Okay. So thanks a lot for the information. Okay. Okay, great. Any other? Okay, fine. Just to tell you about our organization, we have been operating since 2006, and our mission is enabling individuals and organizations achieve excellence. And this we are doing since 2006. And CPHQ trainings we started around 12 years ago, and we have lots of people, who have been certified after attending our trainings. About myself, I am having 31 years of experience, and I have been teaching quality principles, tools, techniques over the last 30 years in various industries, including healthcare. Earlier, I was mostly focused on manufacturing and services industries. Then in 2000, in 2000, I think 4 or 5, I conducted the first ever. In fact, I always take pride in showing you this photograph. So this is one of the photographs in London training program, and this is some other cities. But this particular photograph on the left, this was the first ever Lean and Six Sigma Black Belt certification program held in anywhere in Middle East. There's the first ever program, and I always take pride in telling you that I conducted that program. And then I started the CPHQ sessions because people told me that CPHQ, they find it difficult to pass because of the data analytics module. And since then, I've been conducting CPHQ trainings. Novartis, the pharmaceutical giant in Switzerland, they are client, and they're like, they're just this hospital in China. They also underwent all our trainings: yellow belt, green belt, black belt, CPHQ, almost all the quality related trainings. And so as I said, America, Europe, Middle East, and the Philippines, China, Singapore. We have done trainings programs worldwide and won lots of awards, and also appeared on TVs. And this just let me talk about a little bit about as I see people are still joining in. So maybe we'll allow everyone to join in so that they don't miss out on any topic. So this is one of the
we have Alex with us, and he has
national
done
healthcare.
excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
So many such success stories we have, and from some CPHQ also. Maybe I don't have much time to share so many credentials, but if towards the end,
Andrew Robertson,
I've got lots of.
CEO of King Edward VII Hospital in London, and we would like to use.
So anyway, appeared on TV shows also. Those who are from India, they may also recognize this gentleman. Here I have appeared on quality shows and business TVs as well. This is a Z Business TV, where I did a series of quality shows, and I had a lot of fun. I have been invited to conferences worldwide.
On 21st of May 2019, I'm going to speak in American Society of Quality's World Conference in Fort Worth, Texas.
So just to tell you, and I have published a book also. So I think I've got good credentials to conduct that training program. That's what just I wanted to establish before I start. Okay, so Deputy Health Minister of Saudi Arabia. Okay, one last week. I'll just very quickly show. He is also our and of course the whole ministry and directorate of health ministry there. We have also conducted training from them. This is Sultan Qaboos University Hospital, doctor. And here,
I know you said that.
Yeah.
You have got.
So a lot of people, talking about our courses around the world. Okay, so that was just to establish the credentials, and I hope you have now got trust in me that I'll be able to conduct this training program. Okay, so once again, those who have just joined, I see around 50 people have just joined in the last 2 minutes. So I'm Amitabh Saxena, and I've got 30 years of experience conducting quality-related training programs. And last 16 years, I've been conducting training programs for healthcare industry. Okay, then let us talk about what is CPHQ. CPHQ is a Certified Professional for Healthcare Quality Certificate, and it's an exam conducted by NAHQ. Now, more about it, if you want, you can just go to nahq.org and you'll get a lot of information. But very, very quickly, I'll tell you that this examination has got 4 modules. means it tests you for 4 topics. One is organizational leadership, another is healthcare data analytics, third is performance and process improvement, and the fourth one is patient safety. Okay, and in our training program, we prepare you for everything. Today, I'll be focusing more on the healthcare data analytics and the performance and process improvement. If time permits, I will talk about leadership styles, although it is my favorite topic, but maybe you can see my videos on leadership and especially related to healthcare leadership on YouTube. You can also join my YouTube channel. There's a YouTube channel, Anexas Europe. You can always join that channel, and you can always enjoy lots and lots of knowledge videos. Means, every week I'm posting 2 to 3 quality related tools and techniques. Yeah, and of course, some people are asking, do you conduct CPHQ regular training programs? Of course, yes, I do that. It's a 4 days program. Actually, just now I concluded. That's why, I just now, today only we concluded the last day of the CPHQ preparation course. And I can tell you a lot of people gave excellent feedback, and later on, if time permits, I will show you some of those feedbacks. Otherwise, my team can show some of the Cedar Hospital feedbacks I had sent you for CPHQ towards the end. If my team can be prepared to show that, it will be a great idea. Okay, so why earn CPHQ? It really enhances your career as a healthcare professional. So go for it. Okay, in short, I'll just tell you that. And the exam, no, it is not so easy, but it is not difficult also. So if you prepare with us, we prepare you so well that you are really confident to pass the exam in the first attempt. You can attend our session, generally 4 days of session, which we conduct. You can attend as many times till the time you appear for the exam. You can keep appearing. We also have study groups also. And just to give you a brief idea, it's objective type questions. 140 questions are there. Out of that, 125 are scored and 15 are pre-test questions. The importance of having this knowledge is that you don't spend too much time, not more than 1.5 minutes on every question. 1.5 minutes on every question. Just imagine. So you've got very less time to answer each question. So you have to be really well prepared for that. And our training program prepares you for that. And I'll not talk about too much of other things, because you can find this information on nhq.org. Okay, and fine. So let us, and of course, if you become a CPHQ, you can add CPHQ in after your name. Yeah. Okay, so just to tell you, 28% or 35 questions are related to organizational leadership. Then we have got 30 questions related to healthcare data analytics, and around sorry, someone is telling something. Yeah, so around 40 questions are for performance and quality measurement and improvement, and patient safety has 20 items. So as you can see easily, around 50 to 60% of the questions or 70 questions are related to healthcare data and performance quality, and they are considered to be most difficult as per a lot of people, but not as per our students. So let us talk about the data analytics. If you want, I can just take you through the modules a little bit briefly, that if that helps you. So okay, so my team reminds me that if I can take some poll. So if you can just answer this question: have you undergone any formal quality training before? Based on that, in fact, I will use my examples. So can you please answer this poll? Have you undergone any formal quality training before? So if I see most of you have undergone and you're quality experts, I will talk about very high-end tools. And if I see that most of you are or at least majority of you are, not from quality, or you have not undergone any quality related training. So I'll start with ground zero. Yeah, but I'll have a mix. I will have easy topics as well as difficult topics. Yeah. Oh, it's almost 50-50. Okay, it's almost 50-50. So we have got, not everyone has responded, but as I see that most of the people, in fact, 51% is saying no, and now it has become 53% are saying no, and 47% are saying yes. Okay, so I'll go with the majority. I'll start with ground zero. Okay, I'm going to assume. So you can just, thanks for participating in the poll, and I can see that yes. Mhm. Okay. Now, if you can just answer one more question for me, what is your role in your organization? So I will accordingly take the examples also. We will be learning we will be taking some examples. So I'll take the examples accordingly. So we got administrators 24% and around nurses 25%, and we have physicians 8%. And okay. So I'll advise everyone to participate in the poll so that I can, cater to your voice of customer. You are my customer today. Yes. Okay. So thanks for participating in this poll, and I see that we have got an equal distribution of administrators and nurses, around 25%, and we have physicians too, around 8%, and QA/QC professionals 9%. So I will accordingly, choose my topics. Okay, thanks a lot for this poll, and okay, one more. I think the last one. If you can just, before I start, were you aware of CPHQ before you heard from us? Okay, so as I see, most of you are already aware of, or they were aware of, 75% of you are already aware of. So, okay, sorry, I should have asked this question before. So as if 70% of you are already aware of, I should not talk too much about CPHQ. Okay, no problems. Okay, thanks a lot, and thanks a lot for participating in the poll. Okay, good, thanks. Yeah, and any other thing you would like to share, you can write in the chat box. I can't guarantee that I'll be always seeing the chat box, but on and off I'll keep looking at it, because we have got more than 100 and say 20 or 30 people, 135 people joining. So I can't, if everyone start writing, I can't respond. But yeah, on and off, my team will keep reminding me to respond to some of the questions. Okay, great. Thanks a lot for participating in the poll. And let us now get back, and please answer this question. What is your opinion? Do you agree with this? There are two types of data. Some can be measured and some cannot be measured. Do you agree with that? And I see that a lot of people say yes, okay, and some people say no. So Sarfaraz is telling no, okay, fine. Now, why you are saying no, and why you are saying yes? So some can be measured, some cannot be measured. So let me tell you two rules, or maybe three rules. The first rule is you can't improve if you cannot measure. Okay. And the second rule is you can measure everything. Now you'll ask me, how can you measure everything? So let me tell you. So there are two types of data. When we say that something can be measured, we probably refer to quantitative data, or something which we call it as continuous data. So there are two types of data, and this if you permit me to use my whiteboard, so let me talk about the two types of data. I'm going to tell you how you can measure. You'll ask me if so. The two rules, as I told you, you cannot improve if you cannot measure. The second rule is everything can be measured. The third rule is if you think something cannot be measured, go back to rule number 2. That means everything can be measured. Okay, so now let me tell you how can you measure each and everything. So there are two types of data. What are the types of data? Continuous data and also attribute data. Continuous and attribute data. So when we say something can be measured, we probably are referring to continuous data. Some examples of continuous data could be age, 53.1 years, and that is my age. Then say waiting time of the patient. That is also, let's say, the waiting time of the patients is say 35.2 minutes. That is also continuous data. And the patient discharge time, I can express in minutes or I can express in hours. So 5.2 hours. So if you see carefully, I have got a unit and there is a possibility of a decimal point. So it becomes a continuous data. Please remember this part. Okay. In data analytics, we learn a lot of tools. Sometimes people get confused. Oh, should I use histogram or should I use bar chart or Pareto chart or scatter plots? There are so many tools you are teaching what to use when. I'm confused. There is no confusion if you are aware of continuous data and attribute data. There is no confusion if you are aware of what is continuous data and what is attribute data. Okay. So continuous data can be expressed in numbers and decimal points with a unit. Okay, that is known as continuous data. Why it is known as continuous data? Because it can be expressed on a number line. Okay, this is a number line which goes from, it can have any number, any value. It can take any value. That is why it is known as continuous data. Now, what is attribute data? Attribute data is the data which we feel we cannot measure. Can you tell me something which you cannot measure or it is difficult to measure? Can you tell me anything which is difficult to measure? So we have attribute. Yeah. Tell me any attribute. And I'll tell you a trick. If you want to measure something, make a category out of that attribute, whatever attribute you want. And you can easily express it as proportion, or you can easily express it as percentage. Now, let me explain to you what do I mean. And I have taken up straight away the difficult topic. Don't worry. Other topics are much easier. Easier topics towards the end, difficult topics in the beginning. Okay. Because towards the end, you'd like to relax, isn't it? In the beginning, you have got a lot of energy. By the way, I conducted the full day, I conducted one CPHQ training session for 8 hours. So my energy levels are not that what they were in the morning. I'll try to still keep up my energy levels. But I need your support. Yes. Yes, please tell me attribute data. Attribute grief. Okay, grief. Prasanna is telling grief. Okay. Okay. Anything else? Anything else? Happiness. Okay. Pain. Patient experience. Dr. Gopi Lakshman is telling patient experience. Sarfaraj is telling pain. Happiness. Okay. So easiest satisfaction. Sarfaraj is telling. Now let me tell you. Anything you want to measure, the first thing is you can put up a category. Now, easiest way to form a category, if you don't want to be, you don't want to think too much, easiest way to have a category is what? I'll tell you. Presence of or absence of that particular attribute. Presence or absence of that particular attribute. So let us take some example. Someone said happiness. So let us take happiness. Happy, unhappy. Okay. In my hospital, I checked with 100 staff members. 60 were happy, 40 were not happy. So proportion is 0.0 and 0.4, which is 60% happy and 40% unhappy. Now I have measured the happiness in my hospital. It is at 60%. And I want to increase the happiness in my hospital. So what I will do, I will just take up an improvement project, process improvement project, QPI, quality process improvement project. So as a quality professional, you can remember, when I want to improve something in the hospital or in the healthcare industry, I take up an improvement project. I take up an improvement project. What is the definition of a project? I'll come back to this, don't worry. And I'll ask you questions also. I'll not leave you like that. I'll check whether you understood or not. But before that, let me tell you what will be the approach to improve anything in the hospital. You have to use project approach. Now, what is the definition of a project? Definition of a project is it has got a starting point and it has got an end point. It doesn't exist after some time. A project doesn't exist. Project is dead after some time. It doesn't exist after some time. It's a one-time activity. So sorry. So suppose if you want to reduce the discharge time of the patients in the hospital, then what you'll do? You will take up an improvement project. You'll first identify what is the current discharge time. Let us say it is 4 hours or 5 hours. You will take up an improvement project saying that I will reduce this 5 hours to 2 hours by 31st January, because a project has got a, yes. So can someone tell me what is the basic definition of a project? Project has got a starting date and an end date. It doesn't exist after some time. It is a one-time activity. So what I am doing here is I am going to reduce the discharge time as a one-time activity in 3 to 4 months. And that is my improvement project. And that's what quality professionals in hospitals do. Okay. Project approach towards process improvement. So I am doing an improvement using a project approach, but where in a process. I am doing improvement in a process. Okay. Is it confusing? No problems. I will tell you. What do I mean? See, in our healthcare system, you have to think about the system. We should have a systemic thinking. Edward Deming was a quality guru, and he gave us a systems approach, systems thinking. Don't think about your department. Don't think about your own role. Don't think about your own, say, designation or your silo. This is not a silo. My designation, my role, my position, my department. No, you have to think about the system. The patient, when he or she deals with the hospital, is not dealing with a department. He's dealing with a process. He's experiencing a process. Maybe if he goes to the lab, so lab, you have got a sample that needs to be processed. You give a sample, and then after that sample is collected, it is processed, and after that you get a report, and that whole system cuts across lots of departments. So patient is experiencing not a department, but he's experiencing a process cutting across the department. Now think from customer's perspective. Think from patient's perspective, not from your perspective. So reception is just one part of the system. Then we have got lab as one part of the system. Then the IT department, which is supplying all these IT systems, where the reports are getting published, it is also part of the system. So have a process approach. So Edward Deming said, 85% of the problems are due to processes, not due to the people. 85% of the problems are due to the processes, not due to the people. Change the process and the same people will deliver excellent results. So suppose you see errors happening in your hospital or delays happening in the system. What is wrong with that? Not the people, the process. Change the process. The same people will deliver speedy results. The same people will deliver less errors or commit less mistakes. Process. And who is responsible for these processes? Senior management. Senior management provide all the resources, policies, procedures. So leadership is very, very important. Leadership module. Today I'm not going to talk too much about leadership module, but I'll give you a brief overview. Towards the end, I'll tell you all the 4 modules, what are the things which you need to learn in CPHQ. But before I go there, I'm just taking you through some of the basic statistical stuff. Okay. So, yes, coming back. Now let us get back to the topic. I'm not going to forget. Yes. Now I'll ask you questions. First, let me ask you a question. Have you understood what is continuous data and attribute data? Yes or no? Okay, so some people are saying yes. Well, let me test you. Then let me test you. Okay. Okay. Blood pressure. It is continuous data or attribute data? Blood pressure. Okay, Dr. Gopi is telling continuous data. Okay. Kavita is telling, Prasanna is also telling, Krishna is telling, everyone is telling continuous. Okay, you are right. Infection rate in your hospital. Yes, please. Infection rate in your hospital. Okay, some people are telling continuous, or 1 or 2 have said attribute. So maximum are telling continuous. Okay, so I caught you now. Okay, and that's what happens. See, let me tell you, wherever you see a percentage, or wherever you see a proportion, be a little cautious. It is most probably attribute data. Why? Because when I'm saying infection rate, in a way, I'm telling you infected and not infected. Okay. Infected, not infected. Maybe I'm talking about the overall health of the say environment, environmental health within your hospital, or hygiene. I'm talking about attribute is hygiene, maybe. Yeah. 2 are infected, 98 are not infected, then 2%, if you see 2% becomes the infection rate. So it is still attributed. Now, let me tell you how to identify, understand, how to detect the attribute data. Most probably it will be a count or a percent. If it is a percentage, then it is a ratio expressing 2 or more than 2 categories. Customer satisfaction, 30%. Yeah, 10%, 60%. 60% are extremely happy, 10% are happy, 5% are neutral, 5% are extremely unhappy, etc., etc., etc. It is about, again, categories. Please remember, it doesn't have a unit, doesn't have a decimal point. In order to understand this a little bit more clearly, let me ask you another question. And why it is important to understand the continuous net. Okay. This is nurse A, and this is nurse B. Okay, and I give some work to nurse A and some work to nurse B. Time taken to complete that particular job by nurse A is, let us say, 11.2 minutes on an average. And the same work, when I give it to B, on an average, nurse takes, let us say, 20.1 minutes. Which nurse is better? Which nurse is better? A. Everyone is telling A. Yeah, faster. Okay. Nurse A is committing 10 mistakes per week. Nurse B is committing 20 mistakes per week. Which nurse is better? Which nurse is better? Most of the people are telling A. No, sorry to tell you. First of all, please understand what type of data it is. When I told you time is definitely continuous data. It is continuous data. 11.2 minutes, 20.1 minutes. It is continuous because it has a unit. It has a possibility of a decimal point. But number of mistakes. Can I have 10.1 mistakes? No, it's a count. Okay. There is no unit there. That means it is attribute data. So first of all, as a quality professional, as a CPHQ professional, as soon as someone tells mistakes, you will not make a judgment. You will say, hey, it is attribute data. Tell me about the other category too. You are giving me part information. You are giving me partial information. Mistakes out of how many jobs? Mistakes out of how many patients handled, right? And as soon as you say that mistakes is an attribute data, it has to have another category. And what is that another category? Let us say no mistakes. Okay. And let us say nurse A handled 100 patients, nurse B handled 200 patients. And now tell me, who is committing more mistakes? Now tell me who's committing more mistakes. Who is more efficient? Now tell me, who is better nurse? Who is better nurse? Now tell me. You told earlier A is better. Now tell me who's better. Okay. Or just to make it much easier for you, who's better? Obviously, B is better, right? So, very important to understand the type of data. So, infection rate, defective rate, percentages, they are all related to attribute data. So, be careful about it. Have you understood this part? Have you understood this part? Okay. Now, I'll not go into the details of different tools and techniques right now, but this is just basic thing I just wanted to express. But there are different tools when you are dealing with any kinds of, in the CPHQ training sessions, I teach you a lot of tools like box plots, scatter plots. We teach you different hypothesis tests also, like t-tests, and they're all part of your CPHQ syllabus. Chi-square tests, etc. So which test to use when is determined by what type of data you are dealing with. Okay. We also give you a lot of videos, when we in our training programs. So I'll just pull out one of the videos from one of our training programs, because that will, if you permit me. So it is a 2-3 minute video, but that will, of course, our the content which we provide you is like 24 hours total video content. But today I'm not going to show you, almost all of them, but just very, very briefly, to give you an idea what kind of data, what kind of I'll explain in detail later on, but brief and short. If you want to put everything together and quickly in one video, just have a look at this video. This will give you a brief idea of why it is very important to understand the type of data. Oh, it's just where is the? How can I share my screen? Okay.
Hi, I'm Amitabh Saxena, and thanks for joining our course Anexas.
Okay, let me. Talk about it. Yeah. Yeah.
What type of data you are dealing with. If you are dealing with continuous data, then you might use histograms. If you are dealing with attribute data, you may use pie chart or
So I hope you heard
Pareto chart.
what I said. If you are dealing with continuous data, then you will use histograms. And if you're dealing, and if you are dealing with attribute data, then you can make bar chart or pie chart or Pareto charts.
Or bar charts. If you are dealing with combination of continuous and attribute, like in inferential statistics, then you may be using box plots and scatter plots and regression, ANOVA, chi-square, etc. So the tool usage depends on the type of data you are dealing with. So it is very important to understand the types of data. More about.
Okay. I hope you understood. Briefly, I just wanted to show you there are lots and lots of tools. Now, I'm not going to talk about all the tools here because I promised you that I'll talk about difficult things, but easier things also. So first, let me finish all the difficult parts, all the difficult topics I'll be finishing. And then after that, I'll come to the easier part as well. And but yeah, our job is to make even difficult part easier, isn't it? That's what we are here for. So now coming back. So if I'm looking at going back to our question, don't be afraid of data. A lot of people, they give 3 responses. Just read it. Okay, so these are the responses. We do not collect the data, or we have too much of data. We do not collect the data. I don't want to give you the data because if I give you the data, you will publicize, you will make some nice reports out of it, some graphs and charts, and publicize my inefficiency throughout the hospital. Why should I give you the data? I don't want to give you the data. Or we have too much of data, it's lying around everywhere, but we don't know anything. What to do with that? And analysis is too complicated. I am not a data person. I hate data. Some people say that. All your excuses are null and void once you attend a CPHQ session. Because you fall in love with the data. It's so easy. Let me tell you, it's so easy. There are all softwares nowadays available. Our job is not to learn any statistics part. Our job has become much, much easier. Okay. So next 15 minutes more for your difficult part. Give me 15, 20 minutes. After that, easy part is coming. Don't go away. Don't go away. Yeah. So we learned about two types of data: continuous data, attribute data. Continuous data, usually you will collect 30 to 40 samples. Attribute data, you will collect around 200 to 300 samples. Good enough for 1,100 sample is actually a very, very optimum size for attribute data, but even 200, 300 will do. But for continuous, only 30, 40 samples is good enough because you are able to get your average and a standard deviation. Now, I'm not going to talk too much about standard deviation in our session today, but there is a theorem called Gaussian theorem, which I'll briefly mention because, a lot of things in quality are dependent on that. This normal distribution exists in our healthcare industry. It exists actually everywhere. Okay. So first of all, in the next 20 minutes or so, 20, 30 minutes, I'm going to talk about the little bit of so-called high-end statistics, but that will remove the fear of statistics from your mind. And that is the whole objective of these next 20 to 30 minutes. Okay. Okay. Now, if I collect the data about any process in our hospital, or let me write it down here itself. It's easier for us to refer to this. But before I proceed further, let me sum it up. If I am using continuous data, I can make histograms. Okay. Means I can say patient discharge time in my hospital is on an average 300 minutes. It goes as high as sometimes 450 minutes, but never beyond 450 minutes. And it goes as low as 150 minutes, but it never goes beyond or less than 50 minutes. Heights of people or heights of my staff members, on an average, it is 174 centimeters, but it sometimes goes up to 145. And some people are even up to 190, but no one is beyond that and no one is less than that. Now, a 30 samples, just 30 sample will give you information about almost whole population. You don't have to collect, if you have got 3,000 patients, don't have to collect the data of 3,000 patients. No, just 30 patients will give you enough data. Like 30 patients, if you collect the patient discharge time, they will tell you on an average you are taking 300 minutes. It is giving a picture of whole population of 3,000 patients. 30 patients is giving you information about 3,000 patients. Okay, that's what we have to trust the sample. Why? Because of this normal curve. Mr. Gauss, he found that all the repetitive processes in the world, they follow normal distribution. Why it is known as normal distribution? Because it is normal to obtain a normal distribution. It is normal to obtain a normal distribution. Okay. I'll just increase the height of my chair to be better focused. Yeah. Okay. So so coming back, Mr. Gauss. It's also known as Gaussian curve. Carl Friedrich Gauss. In 19th century, he found this. And this also exists in our healthcare industry. Your medicine dispensing time it follows normal distribution. Your discharge time follows normal distribution. Triage time follows normal distribution. Everything, every repetitive process. Time taken to perform a surgery or a procedure, it also follows normal distribution. So everything follows normal distribution. So it is important for us to know it. Now, if you don't know it, that is your problem, but the normal distribution exists in each of our processes. Time taken to make an X-ray report or blood test report, it also follows normal distribution. So it's time to learn about it, isn't it? Okay, so let us learn. I hope I've built up a nice business case for studying the normal distribution. I've motivated you enough to study the normal distribution, right? Okay, so now let us learn about it. So when I collect a small sample, not too much. Let us take a small sample of, say, patient waiting time. 300 minutes, 320 minutes, 280 minutes, or not patient discharge time. Sorry, not patient waiting time may not be so much. Patient discharge time. In fact, let me use technology, right? So I've collected the data, and when you join our course in CPHQ, we teach you how to use those softwares. In fact, the kit is part of our session. Although you will not be tested on the software in the exam, by the way, but just software is to assist you to understand the things faster. So I've collected the patient discharge time, 300 minutes, 240 minutes, around 15 patients I collected. I can easily, by clicking some buttons, I can make a histogram. It will tell me what is the average and what is the standard deviation. What is the average here? Around 300 minutes. What is the standard deviation? 25 minutes. 25 minutes is the standard deviation. Remember those values. Now, what is the use of these values? Now, let us go. I hope you are with me till now. Hanan is telling, cannot hear. Can you write? My team members can write to her that they can log. Those who are not able to hear at any point of time, they can log out and log in one more time. So my team can just write to that. Write about it. Just please take care of that. Okay, so I hope everyone else is able to hear, right? Okay, right. Some people are telling, I don't have any healthcare background. Is it possible to go for? Then you go for, if you don't have healthcare background, you can go for Lean Six Sigma certification, Green Belt certification, Black Belt. You learn all these things there also. The CPHQ is especially for those who are from healthcare or who intend to work in healthcare. Okay, so CPHQ is specifically for healthcare. Yeah. So if you're not from healthcare, for you, if you want to apply all these techniques, you go for Six Sigma certification. Yeah, just wanted to answer one of the questions by one of the participants. Okay, and please, I'll answer all the questions related to this towards the end. But now this is learning time. Yeah. Okay. Sorry for that. I'll come back to it towards the end. Okay. Yeah. So coming back, average 300 minutes and standard deviation 25 minutes. Okay. Now what to do? Now let us go back to what Mr. Goss told. Mr. Goss told that when you collect the data, it will always have a standard deviation. It will also have average. And one interesting thing about this is it's a theorem. Theorem means it exists in nature. It exists. Why it exists, we don't know, but we can take advantage of that fact. We can take the advantage of this fact that it exists. So what I can do, I can always make improvements based on this knowledge. So what he said was 99% of the population, I'm talking about the population, is between 3 times standard deviation and minus 3 times the standard deviation, plus 3 times the standard deviation. I'm going a little slow because I understand many of you don't have any quality background, or many of you don't have any data analytics background. So I'm going very slow. Okay. And this is the most toughest part of our CPHQ, full CPHQ. I'm covering the toughest, the most tough, most difficult part is I'm covering as of now. In 10 minutes, it will be over. Okay. So this is plus 1 times standard deviation plus 2 times the standard deviation. This is 1 minus 1 times standard deviation and minus 2 times the standard deviation. So now looking at my data, I can predict about all the patients who are discharged from my hospital, what will be their waiting times or discharge times. Average is 300, 1 times standard deviation. Standard deviation is how much? 25. 1 times standard deviation becomes 325. 2 times standard deviation becomes 350. And 3 times standard deviation becomes 375 minutes. This is 275 minutes. This is 250 minutes. And this is 225 minutes. I hope my calculations are right. I hope my calculations are right. Okay. Sometimes, towards this is like end of the day for me. After conducting 8 hours of session, I'm conducting 2 additional hours. Oh. You can imagine, yeah, the sound of my throat is telling you that yes. Yeah. Okay. Okay, great. So have you understood this? Up to here, you are still with me. Got it? Got it? You're with me, right? Yes. Please keep telling me. If you have not understood, please let me know. Now, this I call it as lower control limit, and this I call it as upper control limit. LCL and UCL, lower control limit and upper control limit. And then I can make a control chart. Lower control limit and upper control limit. What is the lower control limit of my patient discharge time? 225. What is the upper control limit? 375 minutes. Means if you come to my hospital, please expect the patient to get discharged between these 2 limits. Now, who set this limit? My process set it by itself. That is why I call this as voice of process. Voice of my process is telling me. See, every process has got a voice. Your lab test procedures have got a voice. Your surgery procedures have got a voice. Your admission process has got a voice. Your registration, patient registration process at the reception has got a voice. We just need to hear the voice of the customer. It's not the customer, sorry, voice of the process. By collecting 30 samples, just 30 samples, average and standard deviation will reveal the voice of the process. Okay. Some people are telling my network is poor and I would request to access the recorded video. No problems. We'll send you the recorded video. So after this is being recorded, it will be on our YouTube channel. It will be also on our Facebook channel. Go to Anexas Europe. In fact, it's live. It's going live right now. It's as you can watch there as well. Yeah. So after that, it will be immediately available. Just don't worry about that. Okay. And you can record. You can see our previous recorded sessions also. We are very good in distributing the knowledge. Okay. There I may be talking about some other topic. I've talked about in one of the topics, emotional intelligence. One time I've talked about leadership. And if you want to know everything together, come to my training program, CPHQ trainings. Okay, we conduct 4 days training, and I'll give you the details towards the end. If you are interested, definitely most welcome. Please join. We will make sure that you pass the exam. How can you not pass the exam? Come on. All the difficult parts will take care. Don't worry. Okay, coming back. Now, this is my process. We call it as control chart. Please expect 2 to 3 questions on control charts in the examination. Control charts. Now, if I see my patients are being discharged between 225 to 375 minutes, my process is under control. It doesn't mean that process is good. It doesn't mean the patient is happy with the process. It doesn't mean my management is happy with the process. It doesn't mean that. It just means that it is behaving as per the expectations. This is the way I have trained my people. This is the way we have our policies, procedures, the equipment, the facilities. Everyone together is delivering this patient discharge time of 225 minutes to 375 minutes. Yeah. 5 hours plus minus, say, 1.5 hours, yeah, approximately. Now, that is what we are. Why this variation? Well, there are so many reasons. We make a cause and effect diagram. Discharge time of patients is dependent on so many things. There is a good way of making a cause and effect diagram. First, how do you make a cause and effect diagram? You get hold of people from the process who understand the process. In this case, discharge process, patient discharge process. Ask them, tell me what is causing the delay, and then they will tell. They'll tell a lot of things. In fact, we did that. And we collected the data. When you are making cause and effect diagram, use brainstorming and also use Ishikawa diagram, fishbone diagram. If you want to know, okay, Helen is telling I'm from Qatar. Hi from, okay, Sidra Hospital, they are my clients. I hope you know Sidra Hospital. Sidra Hospital, I have conducted the CPHQ sessions. And 12 people from that, one batch, I'd conducted for 18 people. 12 people appear for the CPHQ exam, and everyone passed. My team, if you can please play that recording towards the end. I don't know. You have the recording, Naveen, where credentials are being given towards the end, if you can do that, right? I've got many recordings, many videos. Yeah. Okay, but let me show you this video, which is relevant here. How to make a good cause and effect diagram. Now, easy. This is an easy topic. Yeah. I told you, topics will be easier now. Okay. A little bit of difficult topic is still remaining. 5 minutes of difficulty is there, but let me talk about the easier topic. Let me use a video that will help me also, because what happens is sometimes videos give me, I can take some water, you know.
Once we have collected.
So let me talk about the, yes. So using brainstorming, and first let us understand there's some basic rules of brainstorming there. So please be aware of that part. Okay.
Use a tool called brainstorming. It is interesting to note that the first brainstorming is not done to find the solutions to our problems, but to brainstorm on the possible root causes. The purpose of brainstorming is a method of generating lots of ideas quickly by encouraging the creativity. It also involves lots of people, and it also generates excitement and energy within the team members, and it separates the people from ideas they suggest. There are certain prerequisites of conducting a brainstorming session. They are very simple, but they should not be ignored. First, the purpose of brainstorming should be clear to everyone who is participating in the brainstorming. So it's better to give them the topic, tell them what exactly is the purpose of brainstorming in advance. Participants should be from the process or may not be from the process. You may also like to invite the people from other departments to get a fresh perspective. You should also have a facilitator. Facilitator is generally the person who's not participating in the brainstorming. Means he's not participating in generating the ideas, but he or she is facilitating the whole session. Usually he or she can be a consultant or a person from another department, or one of the persons from the team can act as a facilitator. You should also have stationery, and you should also use the appropriate tool of brainstorming. So there are different brainstorming techniques we will be learning in improve phase. You can use either of them. You should have a meeting room and flip charts and other facilities, whatever is required to conduct a brainstorming session. And you should also communicate to the participants about the time, venue, topic well in advance, so they are mentally prepared for brainstorming. As I told you that brainstorming is used for either generating the possible root causes or getting the ideas to solve the problems. There are certain rules which need to be followed in brainstorming. The rules of brainstorming are: give equal opportunity to everyone who is participating. So tell them to participate, and you can use different techniques. As I told you, we will be learning in the improve phase. Capture all the ideas, so document all the ideas. Whatever is being discussed, whatever ideas the participants are given, someone should be there to document, or a scribe you can appoint to document all the ideas. Leave your designation and ego along with your shoes outside the meeting room. That means don't think that if you are senior, your idea carries more weightage. So obviously this ground rule should be very clear to everyone, and everyone should be encouraged to give an idea, and everyone's idea should carry equal weightage. There should be a non-threatening environment. When people are giving ideas, they should not be afraid of giving ideas. So you should create an environment where people should be encouraged to give the ideas. Also, we should ensure that wherever the brainstorming is taking place, there should not be any disturbance, so people are focused on brainstorming. Sometimes people might deviate from the topics. There is a tendency that some important issue crops up during the discussion. So at that time, you can always create a parking lot saying that, well, this idea or this issue is very, very important, and we can park it to be discussed after a while once we complete the brainstorming on this particular topic. We should encourage people to fantasize freely. We should not put brakes on our thoughts. So you can give some out-of-the-box ideas, you can give some wild ideas, and if people are giving you wild ideas, they should be encouraged. If you give a specific duration of brainstorming, we should try to complete the brainstorming within the time duration, and defer evaluation. Now, this is one of the rules which is often violated. People start discussing the ideas. Someone gives an idea and someone else says, well, it will not work in an organization. Or some other person gives an idea and someone else comments that, wow, it's a great idea. So don't evaluate. Reserve your comments for evaluation at a later stage. When you are generating the idea, when you are generating the root causes, they are not to be evaluated. You cannot say that it is a good idea or this is a very good root cause which you have thought of. No evaluation, just write down whatever is being suggested. Generate quantity. Do not worry about the quality at the initial stages. So you have to generate lots of root causes, lots of solutions. More the better. A pearl diver, he dives into the sea to find the pearls. If he just collects 10 oysters, the probability of getting the pearl is very low. But if he collects thousands of oysters, the probability of getting the pearl is very high. So similarly, if you want to collect great ideas, some of the out-of-the-box ideas, some creative ideas, then definitely you should create more and more ideas. So how to generate those ideas? There are different techniques. Some of these techniques.
So if you want to learn a lot of great idea generation tools, I have got different 3-3-minute videos of like 635, anti-solution, and round-robin techniques, etc. So you can watch them on our YouTube channel. You can always subscribe. It's all free for you. Yeah. Okay, great. Now, now you have learned about cause and effect diagram. So you can make a nice cause and effect diagram. And if you want to use technology, you can even use that. So I have got man related to man. I've got certain, say, if you want to see the full cause and effect, okay, no problems. You can watch. No issues, no issues. Yes.
Techniques we'll be discussing in our improve phase. But right now, we are in analyze phase. And as I told you, either you are using cause and effect or tree diagram, you can use brainstorming. And the first brainstorming is, interestingly, to find the root causes. We can use brainstorming to generate a lot of potential causes of the problems you defined in measure phase. You can
There's
use
one more
why
why.
to push
Why
for
technique.
root causes.
Let
To
us look
push for root causes, start with your focused problem and then ask why several times. For example, focused problem could be customers complain about waiting too long to get connected to staff during lunch hours. You can ask why 5 times. Why does this problem happen? Because backup operators take longer to connect callers. Why? Because backup operators don't know the job as well as the regular operator or receptionists do. But why don't operators know the job well? Well, there is no special training. No job aids make up for the gap in experience and on-the-job learning for the backups. Why? Because in the past, the organization has not recognized the need. But why? Because the organization has no system to identify training needs. So this becomes the root cause. 5 why becomes a way of mild deep thinking. Why causes, you can use different techniques. One of the techniques is 6M technique, where you can brainstorm on causes related to man, machine, material, methods, measurement, and environment, which we can also brand it as Mother Nature.
Okay, so if I want to make it, and I just brainstormed on all the possible causes of my high patient discharge time, and I can see after brainstorming, people gave me lots of ideas like man-related, staff not available, skills, motivation, machine, no equipment, old equipment, materials, no stationery, documents missing, no SOP, discharge summary delay, so many things. So what I do, I just make a cause and effect diagram, and very easily I can make a cause and effect diagram. So these are all the causes. And now on that, I will apply Pareto. Pareto means 80-20. What is Pareto chart? Pareto chart tells me that 80% of the problems, 80% of the problems are due to, so 80% of my discharge time is problem in discharge time is due to only 20% of the causes. Wilfredo Pareto was an Italian economist who found that 80% of the wealth in Italy was with 20% of the people. So he called this as 80-20 rule. And Joseph Juran, he was a quality guru, he applied this 80-20 rule to quality, and he said 80% of your quality related issues, 80% of your delay, 80% of discharge time delay is due to 20% of the causes. So if you have listed down 10 causes, all 10 causes are not responsible, only 20% of 10, which is 2. Only 2 causes are the root causes. So focus on them. Now, how will you do that? Collect the data. You'll collect the data and find out which cause is occurring more frequently. And based on that, whatever is occurring more frequently, that becomes your cause and effect. So we collected the data. We found that reporting not accurate is occurring more times than we have got. Discharge summary delay, it's occurring 8 times. Staff not available 23 times. So many. So you have got all the possible root causes, and you can quickly do a bar chart in descending order, like which is highest cost, lowest cost, lower and lower, lower, which is known as Pareto chart. So if I were to just show you quickly, because right now, to give you a foundation, I'm doing an overview right now, so I can be a little fast here. So I collect the data, and I find that reporting not accurate, staff not available. These are the top 3-4 reasons are coming, are contributing to almost 80% of the delay. What are the top 3-4 reasons? First, second, third, fourth. if you see, add them together, this plus this is this much, this plus this is this much, like 29% contribution by first, 25% contributed by second, first and second together is contributing 54%, and so on and so forth. So the top 4 causes, which are contributing to 80% of my problem, I will focus on them and they become my root causes. So that's how I will validate my root causes based on the data. And then I'm now in this way, I will be more, confident of solving the problem because I have got the data-oriented, data-based root cause. So I'm more likely to get my solution. So I will now focus on solutions only on the root causes. I can also validate my data. Like, suppose one of the causes was discharge summary delay. Discharge time. Is my discharge summary delay in discharge, writing the discharge summary, is it delaying my discharge time? Now, most of the people will say yes, but now as a quality professional, you will say, no, sorry, I will make a chart. Now, which chart I will make? When I am dealing with both continuous data, I'm trying to correlate the two. Both are continuous data. Discharge time is continuous data. Discharge summary delay is also continuous data. So in this case, in such situation, see, depends on what type of data it is. So if I have got both the continuous data, this is discharge time Okay, so Atu Marius is asking, I would like you on Facebook. Okay, Facebook. Okay, thank you. I'll subscribe to YouTube. Okay, thanks a lot. And if there is an Instagram account, yes, by the same name, Anexas Europe. It is the same name. You can please, yeah. Every day, see, every day I put something there related to quality. If you just go back to all the previous posts, you will see some quotations, quality quotations, etc. My team would have shown some quality quotations in the beginning. If you joined a little early, they all displayed all the quality related quotations in the beginning. So discharge time, then we have got, yeah, so we are coming to, yeah, discharge summary delay. If the relationship is like this, if I see, I will say there is a positive relationship. Means discharge summary delay, if it increases, just discharge summary time increases, discharge time of the patient also increases. But suppose this is the case. Well, discharge summary is written in half an hour, 1 hour, 2 hours, but still I take all, there is no relationship. Still, sometimes discharge time is 4 hours, 5 hours. Every time it is 5 hours. I write discharge summary in 1 hour or 2 hours. Doesn't matter. That means the root cause is somewhere else. Then discharge summary delay is not the root cause. So what I am doing with the help of charts and graphs, I am validating. I'm not making a judgment based on my logic intuition. This is not allowed. You have to collect the data. Data analytics, healthcare data analytics, the module name itself is. So in the exam, they will show you some charts. They'll ask you to make conclusions. They'll ask you, this relationship is positive or negative. This will be a negative example of negative. Training time, more training you provide, and time taken to complete an activity, it reduces. Negative. This is one is negative relation. And then the above one is no relation. And if something like this is there, it's a positive relation. There's a coefficient, Pearson coefficient also. -1 to +1, it takes the values. +1 means this is +1. Exactly straight line relationship is -1. And exactly no is between -1 to +1. -1 is perfect negative correlation. +1 is perfect positive correlation. And in reality, things will be something like this. Never you'll get a perfect correlation. It is like 0.8. This will be -0.8. Okay. So the values will be between 0 to 1. As it approaches 1, that means this is strong relationships. If it is less than or somewhere in between 0, around 0, it is like no relationship, but weak relationships. I'll not talk too much about that. I just wanted to give a brief introduction. Okay, so this was about, so let me come back to my control charts now, not to forget. So now what we have seen. We collected the data, we got our average, we got our standard deviation, lower control limit and upper control limit. I make my control chart. Now, if I am between this, my patients are being discharged between this, I say my process is under control. But suppose one patient gets discharged very high sometimes. It's a special cause. We say there is a special cause and I can find the special cause. I'll go to the cause and effect diagram and I can pinpoint the special cause. This is because of this one reason. But what about this variation, which I've painted in yellow? We call it as common cause variation. Why common cause variation? Because all the causes which I've listed here acting on my system and producing this variation, we call it as common cause variation. Question generally will be asked. Common in short, like 2 hours time, I'm trying to give you as much as knowledge. There are 140 questions, so I can prepare you for only 30-40 questions in this class. So one questions for cause and effect diagram, always 1 to 2 to 3 questions. 2 questions on Pareto chart diagram, 2 to 3 questions on control charts. And I've prepared you for 10 questions right away. Plus, some time is remaining. Now I'll prepare you for other questions also. And I've also talked about the types of data that also maybe 1 or 2 questions will be there. So common cause, special cause. There are other rules also, but I'm not going to talk about those rules. There are some rules of 7, alternating 14 points, etc. There are other rules also which indicate that there is a special cause in the system. Well, now my process is operating, it is under control. Does it mean I should feel happy about it? No. I have a voice of customer too. My patient tells me, please don't ask, please discharge me within 1 hour, 60 minutes. So what I have to do through process improvement, I have to bring my process, change the control limits of my discharge process. That is the whole intention of our QPI, quality performance improvement projects. If you are using, so you will be learning very briefly about Lean, very briefly about Six Sigma also. In Six Sigma, if you are using Six Sigma here, you use DMAIC methodology. I will introduce you to DMAIC methodology by showing you a project. If you are using Lean, then you will map the process. You will identify the waste. So I'll talk about Lean also. So in the next, say, 15-20 minutes, let me first talk about Lean, and then I'll show you a DMAIC project, some DMAIC projects. Okay. So the statistical part is over now. Yeah. Feel happy. Okay. Now let me talk about Lean. Now Lean part is, okay, DMAIC I'll talk about later. Okay, let me first talk about DMAIC. Okay, let us first talk about DMAIC, then I'll talk about Lean. So DMAIC, define, measure, analyze, improve, control. So whenever you are doing a process improvement project, DMAIC project, also call it Six Sigma project, then you follow 5 phases. First, define. Define means you will write a project charter. The patient waiting time is around 120 minutes. Okay. And I would like to reduce, so I've got a problem statement here, I've got a goal statement. And we would like to reduce this it's 93 minutes today, and we would like to reduce from 93 minutes to 30 minutes. That is my problem statement and goal statement. Always, whenever you are doing an improvement project, you will write a problem statement and goal statement. And then, what are my possible dates of completion of my define, measure, analyze, improve, and control? If you are using PDCA, then plan, do, check, act. You can do plan, do, check, act. It follows almost similar process. The next step in the define phase, I do CPHQ, supplier input, process, output, and customers. Done a BD, a healthcare quality group. He talked about systems approach, talks about outcomes, processes, and structures. So what he refers to suppliers and inputs, he refers to structures. Process as process, outputs, outcomes. So you have to first identify the customer. Who's the customer here? Patient. What are the outputs of my process? And which process I am talking about? Patient treatment process. What are the outputs? Prescribed treatment or treated patient, and billing also. What are the steps? I have mentioned the steps. What are the inputs? Patient history, registration forms, doctor, receptionist, etc. These are the inputs. Now my output is dependent on inputs and processes. So focus on the inputs and processes. Don't focus too much on outputs. Output, I call it as Y. And the inputs and processes, I call it as X factors. Okay. So we say Y is dependent on X factors. I hope you are understanding. I'm trying to, within the 2-hour time, limited time, I'm trying to a little bit speed up. So I hope I can explain that in great detail. Okay. Hanan is asking if you need to take the course and certificate, when can be, and is it online? Yes, it is online training. Some people are asking about registration. Can my team put the registration? If some people want to register, they can register. Of course, you can register, yeah. So my team will put a registration link right now. And if you want to register for our CPHQ training sessions, please register. Okay, I'll tell you the dates also. I'll tell you the dates. Okay, so here, so patient, outputs, process, inputs, and suppliers. Okay, so this is like a systems map. We call it systems thinking. And then I I collect the data and make my average and standard deviation. And this is what the status of my patient waiting time is today. And then I look at the cause and effect diagram, why my patients are waiting for a long time. And then I make a Pareto chart. So one project, if you have learned, you can now easily see. It's very easy. It's not difficult. In 4 days session, we prepare you so well for the training, for the CPHQ exam, that you can answer all the questions very confidently. So we have a Pareto chart, 80-20 rule. There's another tool called box plot. I did not discuss it today. So there are different tools, there are more tools also. So you'll be asked you'll be learning 40 to 50 tools, in process improvement itself. So finally, you give an improvement, generate ideas, and then you hold the gains. After some time, you see, after giving some improvement suggestions, you have reduced the patient waiting time. It is like that for a long, long time. It should not happen that, it reduces for some time and it goes back again. No, then that is not an improvement. That's not there's no point in improving like this. You have to improve, and then you have to sustain the gains. You have to hold the gains. Otherwise, there is no point. So that is very important. Another project, maybe quickly. Okay, of course, towards the end, you have to make a control charts. And you can make control charts. That's what in Minitab, it's very easy to make control charts. So another project was the MRI scan for multiple. This is in US. This was done in US. An MRI scan for multiple exam with contrast takes 25 days, and patient requires sedation. Then the waiting time was 6 to 8 weeks, which increased the patient dissatisfaction and the inability of the hospital to meet customer demand despite the presence of excess capacity. So they thought additional equipment will help. They bought additional equipment, it did not help. Anyway, so you have got goal statement that you would like to reduce it to same day. And if there's multiple exams, then 10 days. Okay. So they bought additional equipment. What happened? The total number of daily exams still remained the same, and per equipment it reduced. So the real problem was not the equipment capacity, but the problem was somewhere else. Where was it? Let us see. So it was with the, we make, of course, the histogram here. Then master schedule and insurance authorization process. These were the two root causes. After a Pareto, we found this was the two root causes. Then we worked on it. We worked on it and we were able to sort out. Now, I'm not going to discuss this whole project here. Just see the flow. So the earlier master schedule was as per the availability of our staff. Now we made a master schedule as per the arrival of the patients. Okay, so we changed the master schedule. That really helped. And also we are making some changes in the insurance authorization process. We were able to increase the number of scans and reduce the waiting time to same day or less than 10 days. Let me talk about FMEA. There's another tool called failure modes and effects analysis. It is also used in patient safety. Now, what is a tool of FMEA? FMEA is failure modes and effects analysis. It is like, you have to write first what process we are talking about. So I have to write the process. What can go wrong with the process? What is the effect on the outputs? Then I have to write the severity rating of that effect. Rating is always between 1 to 10. 10 means very, very severe. 1 means very less severe. My team will put the FMEA video, because in detail, if you want to learn, I'll briefly talk about. I've given some examples. So my team will put a video link. You can always watch that. So, but briefly, I'll talk about here in the classroom. So here, 1 to 10. 1 to 10 means 10 means very, very severe. 1 means very less severe. Then causes. What are the possible causes? I'll write down for that particular failure mode. How often these causes occur? 1 to 10 again. 10 means every time this occurs. 1 means never it occurs. Then I will write down the current controls. What are the current controls? Current means today what I am doing. And if it is effective, I will rate it 1. If it is not effective, I will rate it 10. See, 10 means high, bad. 10 means bad rating for the hospital. 1 means good rating, always. Every time a problem is occurring, 10. Very, very severe, very bad, 10. The control is of no use, 10. Then I multiply these numbers. Whatever numbers I have identified, severity rating, occurrence rating, and detection rating, I multiply to get the risk priority number. Okay, let me show you one example. I think example will help you understand. Due to shortage of time, I can't go, I cannot explain too much, but let me show you the quick example. The example is, okay. So patient file, health inpatient file, pediatric patient file. In pediatric ward, there are a lot of patient falls. So I want to reduce it. So I'm doing an FMEA, failure modes and effects analysis. Patient safety, mostly used in patient safety, and otherwise anything you are doing so for the first time, you can use that. So first is failure mode is, so let us look at that. Which process I'm talking about? Pediatric patient handling. What is the failure mode? Patients fall down. What is the failure effect? Injury. How severe is the effect? It is very severe. It is 8. 10 means very, very severe, means death or something like that. So not so severe, but 8 is also severe. Injury is severe. Potential causes. What are the potential causes of patients falling down? Lack of awareness of family, lack of awareness of staff, wet floor, medication. Okay. How often it occurs? Now I am writing the occurrence rating. How often it occurs? Lack of awareness of family, every time, most of the time, 7. Lack of awareness of staff, well, our staff, there is no lack of awareness. It occurs very few times, 2. 1 to 10 rating, I have to give between 1 to 10. Wet floor, maybe 4. Medication, maybe 5. So I have given the occurrence rating. Then, what are the current controls to prevent this fall? What are the current controls? Well, I educate the parents. What are the current controls to take care of lack of awareness of staff? I have an orientation program. Now, educating parents, is it a good control? No, not at all. We educate the parents, but no one listens to us. It's a bad control. So it gets high rating, 8. Then I multiply the severity rating of 8 multiplied by occurrence rating of 7 multiplied by detection rating or control rating of 8 gives me 448 as the risk priority number, RPN. Risk priority number, RPN. Well, very high risk here. I need to give some suggestion. The other ones, they are low risk, lack of awareness, orientation, not a big risk here. We are doing pretty well there. Similarly, for each of them, we get the risk priority number, and wherever I get the risk priority number as high, I will take an action. And that's how I make my decisions. Okay. So this is your FMEA. Then comes our so this was about FMEA. Now let me talk about the lean applications. Some of the lean applications. Very quickly, let me talk about, say, there are in lean, what have to do? We have to identify the process and the waste in the system. So there are different types of wastes. Okay. So we have to think from value added from customer's perspective. What is the customer looking at? What value addition the customer is looking at? I have to talk about that value added. And what are the wastes, different types of waste? I'll tell you. There are 7 wastes: transportation, motion, defects, errors, etc. We are not talking about the waste which we throw in the dustbin. No, that is not the waste. We are talking about the process waste which is present in the process. Let us take an example of CBC blood test process time. What is the value add from patient's perspective? What the patient is looking at? See, value addition is always from patients or from customers' perspective. In a blood test, what we are looking at? We are looking at knowing about the health status of the patient. Now, walking to the OPD, registering in the OPD, they are not adding any value to the whole process, unfortunately. You will say, well, it is. How can I make a lab report without registration? Well, registration itself is not adding any value. We have done in many hospitals, we have removed the registration process altogether. I'll not be able to describe this much here, but we have done it. No registration, just walk down, give the blood, take the report immediately. It can happen simultaneously. There are other ways of registering the patients, not the traditional ways. So in a way, only 2 steps, you see, only 2 steps are adding value. The remaining are all non-value added or wastes. The definition of waste is anything which is not done right the first time, anything the customer is not willing to pay for, they are all known as wasteful steps. One example of one of the waste is waste of intelligence. 80% of the nurse calls are housekeeping in nature. My pillow cover is dirty, my bed sheet is dirty. Now, nurse is not here to take care of all these things. If you divert the nurse's attention to pillow covers and bed sheets, she will forget to give you the medicine. So it is a waste. If you indulge nurse in other activities like administration procedures, too much of reporting, etc., you should see every over processing is also a waste. So you have to identify waste in the system. There's so much of waste around in the hospital processes. You have to map the process. We call it as Gemba investigation. Gemba means go to the hospital, go where the action is taking place. Move around in the floors, move around in the hospital, watch the waste in the process. You'll see, you have to develop an eye for the waste. So you have to get you should be an expert in identifying the waste in the hospital. There's so much waste in our processes. Maybe very quickly, I'll tell you some of the things. We doubled the cardiology lab capacity from 8 to 16. My report was also published in various medical journals in US, in Middle East, and Europe. Reduced diagnosis to exam from 2,000 minutes to 64 minutes, cutting down admission time from 17 minutes to 5 minutes. By just eliminating the unnecessary steps in the process. It's very, very simple. You can map the process, apply ESCAP technique. ESCAP means eliminate, simplify, combine, automate, parallel, ESCAP. My team can put ESCAP technique. Can you please put ESCAP, the details? You can watch the video later on. There's not much enough time for that. So you can watch this video, ESCAP technique, later on. So you can ask 5 questions on every step. Can I eliminate it? Can I simplify it? Can I combine it? Can I automate it? Can I make it in parallel? Okay, so ESCAP. So all these things, lead to a lot of improvements in the hospitals. And they're the simple techniques. They're not like any complications. No, here there's no analysis, data analysis also. Finally, you create value. Some of the funny examples of our waste in the systems could be so like unnecessary process motion, unnecessary waiting, unnecessary transportation, errors, unnecessary stock, production, person who's not utilized, equipment which is underutilized. Cost of 5-minute MD walk is $6. Okay, walk to elevator 1 minute, elevator wait 3 minutes, elevator travel 1 minute, walk to lab or pharmacy 1 minute. Cost per a nurse cost per hour in US dollars 50. So cost one trip is 5. Cost of 5 trips per day per nurse 25. And you can imagine multiplied by number of nurses. You can imagine how much money is lost. Okay. Lab and pharmacy on 2nd floor, radiation equipment on ground floor. So a lot of to and fro motion, waste. Bring them together on 1 floor. So this is all some examples of patient waiting and while doctor is on call. Okay, interruption. It's waiting. Admission process, most of the time people are waiting to be getting admitted and your discharge times are unbalanced. You're giving discharges in the evening. Why don't you give in the morning so that the beds will be vacant for the patients? This is known as line balancing in lean. There's another tool called Peacock. Peacock means mistake proofing. Even by mistake, you cannot commit a mistake. Okay, so that is some of the things we learn about. I think due to lack of time, I won't be able to cover everything. But in my CPHQ training sessions, you are most welcome. You can join my sessions if you are interested. Many people were interested, so I will just give the details for that. Okay, let me ask you, how many of let me take one poll. How many of you are interested in joining my sessions? If you can just participate in this poll. Sorry, did I launch the poll? Okay, just a minute. Sorry, I relaunched the poll. Sorry. Okay, yes. Can you please participate in this poll? So that will help me to give you the information. Okay, so I see around 93% of you are interested in participations. So, I'll be happy to welcome you. And thanks for showing interest. So what I will do, I will tell you how to join our sessions. So by joining our sessions, of course, we have a sort of a partnership with CPHQ participants, aspirants. It's our responsibility to make you pass the examination. So success matters, and it's high quality training. You just saw a little bit of glimpses of that, and just like it's 2 hours, you'll be spending 4 days with me, and I'll take you through lots of case studies, lots of examples, and we have got many credentials. Maybe I will not go into the details, but CPHQ professionals, I think some after I complete, Naveen, you can show that. It gives you enhances your career also, and you'll be getting a certification from Anexas Europe and accredited training organizations of IESSC, PMI, ISO 9001, and People Cert. We are affiliated to a lot of organizations. I have myself spoken in NASU conferences also, and you'll be getting. So earlier it used to be $600, but if you are, it's a regular price. It's a regular price. Next week I'm doing in Muscat. I'm charging the same thing, but for this course, for this, if you register by tomorrow, then you will be getting less than $300 if you are you are coming in first registration. First 10 registrations will be charged. Usually, first 10 registrations will happen by tomorrow. So try to do it as fast as possible. And after discounted price, after 10 registrations will be $300. So try to, register as fast as possible. And that will also, and a lot of other things like we'll give you Lean Six Sigma Yellow Belt, one more training. It will be given free along with the certification, project completion certification, real projects from hospitals will be given to you, Minitab software will be given to you, virtual project completion. In the classroom, we will be completing a virtual project. An annual membership to alumni group, which is costing $50. It's free forever throughout the life. So if you are a PMP, project management, and then you'll get a PA to use also. So you can always avail of this advantage. And those who are not from healthcare, you can always join my Lean Six Sigma Green Belt or Black Belt training programs. Also join my PMP project. I conduct project management trainings and CPA and the Lean Six Sigma Green Belt and Black Belt trainings also. So my next programs are happening on weekends, and October 22nd, 23rd, 29th, and November 6th. So you are most welcome to join. So Iqbal is telling that he's interested in PMP. My team can send the details to him. Okay. So we have got October 22nd, 23rd, and 29th, and November 6th, the forthcoming batch. So I'll see you there, and I'd like to invite you. I would like to invite you to our CPHQ training program, and also Green Belt, Black Belt, Master Black Belts, and PMP trainings as well. Okay, subscribe to my YouTube channel, Facebook, Instagram, Twitter, LinkedIn page. Now I'm free to give you an answers. If you've got some questions, I'll be happy to answer the questions. Till the time you can show. Yeah, so once again, the dates are 22nd, 23rd, 29th October. And if you want to enroll for future batches, you can enroll, but you can take the advantage of today's pricing. And let me tell you, this pricing always, most of the time, our batches are full, and we charge $600. But as a special price, we are giving you for whenever I conduct a foundation course, many times people register together. So that is why we are giving a discount. Okay. And yes, so any questions you have? Okay, one more, Paul, if you can just tell me, are you planning to appear for CPHQ exam anytime in near future? Discounted fees less than $300. Less than means if you first 10 will get much less. So it starts like, it keeps increasing as the number of registrations increase, it keeps increasing. So first 10, it will be less than $300, and after that it becomes 300. Okay, so yeah, thanks for participating in this poll. Okay, any questions you have? I'll be happy to answer. Any questions you have? Naveen, do you have the CPHQ professionals that day? I think you had made. Do you have that part?
Sorry.
Do you have that CPHQ professional that two?
Yeah, I do. I'll share.
So if you can just share that, that will be great. Yeah. Yeah.
Future
So these are
CPHQ professionals. I just want to give you a bit of an idea of our last 3-day course on the CPHQ exam preparation. It was awesome. We covered the majority of the topics in a very targeted and focused way that allows us to later on focus our studying and our energy and our time on what really is of value for the examination, but more importantly as well, because of the practical examples that Amitabh was able to provide us in our everyday healthcare work. One thing that I really benefited from the course is that Amitabh from Anexas was able to provide us with answers and solutions, especially at the statistical level, to questions and problems beyond the CPHQ course, to exercises and projects that we do in our everyday work life. For that, I would definitely recommend the course, taking it with Amitabh and Anexas. It's been a great experience, both for my preparations for CPHQ, but more importantly for my everyday work. Thank you so much.
Hi, so I've just completed 3 days training of the CPHQ, which has been absolutely fantastic. Amitabh from Anexa has been phenomenal. The course materials have been fantastic. I think what I really enjoyed about this was that I could relate a lot of this methodology to healthcare, and a lot of the examples were things that I could contextualize it with healthcare. So I'm from here in Qatar at Sidra Medicine, and so again, thank you to Amitabh for this fantastic training.
You're on mute.
Yeah, so we have got many credentials like that. This was Sidra Hospital because someone referred that they're from Qatar, so I just showed you, and many of them are already CPHQ now. Okay, good. Any other questions you have? So Allah is telling, I need huge support. Of course. First of all, this will be like spread over 2 to 3 weeks, and you can later on also, you can always contact us. It's not like, we just go away. It's not like that. And we have been doing this for last so many years. So you don't have to really, worry too much about that. After the training, we'll just don't even bother to ask you or respond to you. So we are there for many years, and there's a good team with me, of course, who are supporting me with the full support. They're a 25-member team, and they all help you. They take care of your administration part. Everything is taken care of. Excellent, great. So if there are any, what else? You WhatsApp to communicate. Okay, how much you can that? Yeah. So I think everyone, the training is, you got some good examples backed out. Okay. I'm from non-medical background. Am I eligible? Yes. You don't have to, if you intend to work in a hospital, then of course this course is for you. Or if you're something to relate to the, in general to healthcare, this course is really for you. But if you're not from healthcare, but you want to learn those tools and techniques, And in Lean Six Sigma, we teach much more than that. What I have told is also we teach in Lean Six Sigma, but we teach more than that. CPHQ, you don't have to go into so much of details, but Lean Six Sigma, you have to go much, much deeper. Yeah. Okay, great. So thanks a lot for attending our session, and see you in my training sessions. I'm looking forward to welcome you. Starting on next weekend, not the next weekend, I think next weekend, 22nd October, 23rd. Thanks a lot.